Module Overview. This foundational module introduces you to medical terminology as a standardized language used by healthcare professionals around the world. It highlights the importance, history, structure, and function of medical terms in clinical and administrative settings. Medical terminology is the bedrock of effective communication in the medical field. It transcends language barriers, prevents misunderstandings, ensures accurate patient documentation, and improves the quality of care. First, definition and role of medical terminology. Medical terminology refers to a system of words that are used to describe specific conditions, diagnoses, procedures, anatomical parts, and diseases. It creates a common language understood by healthcare professionals globally, reducing ambiguity and increasing patient safety. For instance, the lay term high blood pressure may be easily misunderstood or generalized, while hypertension is universally recognized as a specific diagnosis. Second, historical origins. Most medical terms are derived from Greek for diseases diagnostics and Latin for anatomy and structure. Example, cardio, from Greek cardia equals heart, pulmo, from Latin pulmonis equals lungs. Eponyms, terms named after people, such as Alzheimer's disease or Parkinsonism, are also introduced. Third, why standardized terminology is important. Enhances patient safety through accurate documentation and reporting, promotes clear communication among interdisciplinary teams, ensures legal and ethical compliance in records and charting, enables universal understanding across different countries and regions, aids in medical coding, billing, and research analysis. 4. Categories of medical terms. Descriptive terms. Describe size, color, shape, location, e.g., hepatomegaly. Eponyms, named after people, e.g., Hodgkin lymphoma. Acronyms, abbreviated, e.g., MRI, CT scan. Abbreviations, short forms, e.g., BP for blood pressure. Fifth, the language of medicine in us. You examine real examples from medical charts, prescriptions, and operative reports. They explore how a single term may differ depending on specialty. Lesion in dermatology versus neurology, block in cardiology versus surgery. Real-world application. Medical receptionists recognize terms on referral letters. Nurses decode shorthand in a doctor's note. Lab technicians interpret test orders written in abbreviated form. Coders assign correct billing codes from chart documentation. Healthcare assistants understand patient diagnoses for home care tasks. Learning outcomes for Module 1. By the end of this module, you will be able to define medical terminology and explain its relevance in healthcare. Identify the primary origins, Greek and Latin, of medical terms. Differentiate between layman language and clinical terminology. Recognize categories of medical words, eponyms, acronyms, abbreviations. Apply the concept of medical language to real-world scenarios.